Well, I don't have the other, so I can listen, so it's nothing.
Well, good afternoon, everybody. We'll get underway here. Not sure if Commissioner Richardson's going to be in person or on the phone, but we'll just start. Thanks for taking the time out of your afternoon to join us for the work session around ARPA funding. Thanks, Bailey, for putting together that spreadsheet. Super great, really helpful. I did some research again today, and according to the U.S. Department of Treasury, there are 4 funding objectives for ARPA funding. And the first, I guess no particular order first, it's not prioritized, but support urgent COVID-19 response efforts, replace lost public sector revenue, support immediate economic stabilization, and then address systemic public health and economic challenges that have contributed to the unequal impact of the pandemic. So those are kind of the guiding principles as we set about working on this. And so I thought, and Sue, help me if this is a course you don't want to take, that we might set funding objectives maybe under those pillars and then fill out from there. See, we have already done some work with broadband, and we've also done some employee hazard pay, and then the vaccine incentives with United Way. Those seem to fit under different pieces of the ARPA funding. But is that something you to divide up the $7.5 million, or how would you like to go about doing this?
Yeah, I think we can take it up that way. I'd like to also prioritize these as well.
Yeah.
So the applicants, some idea of what they're going to get, not just waiting out there. No?
Yeah. So I'm thinking that since we have $7.5 million, if we were to equally fund each one of the priorities, it would be like 1.9-ish, or a little less than 1.9 per each category, but we don't have to do that. We could certainly prioritize something more than the other. And then that would give Bailey guidance, and then maybe everybody in the room guidance to start building from there, you know. Does that sound like a
that sounds like a good approach.
Tracy, you want to weigh in on that at all, or do you have a thought about that? Does that?
As far as the pillars, of course, my favorite one is the revenue replacement.
Right.
And when I did the calculation, I came up with about 750,000, which then could be further reallocated if we can't use it. So I guess in my own personal feeling or conviction is that setting that aside, and then you can go from there.
Okay, and so then
maybe then the other pillars.
And then the other pillars would have a little bit more in each one of them. Since we couldn't use the 1.8 into revenue, we couldn't justify that. So then we would have 6.7 to divvy up amongst the other 3 objectives.
Yeah, that was my feeling.
Yeah.
You guys can take that forward.
Okay.
Yeah.
That grain of salt.
And then I'm guessing maybe, you know, we could leave a contingency out there so that if something came up in the next 2 years, that we would have money available to address it that we don't see today. So, you know, Bailey, do you have a thought on that? Do you think there's a percentage that you think would be reasonable to leave in outside of our funding right now, or what are your thoughts?
Let's see, my thoughts on dividing up into 4 categories. I think that's a perfectly good place to start. It is with this funding, there's not a lot of guidance on it, which is making it very difficult, and trying to find a starting place has been difficult. And I think that's a very decent starting place. I think one thing you guys should just consider is if we put so much in public health and we decide we really don't need this much in this public health category, that maybe be willing to maybe move it somewhere else if, you know, something else comes up, like you said. For an actual percentage on what, like to put something contingency wise, I think that's a very good idea. I don't know ideally how much you should do. I don't know what exactly you have in mind that might come up. Because if it's more construction related that might come up, you would probably want more in there. If it's more, if we have another rush of, positive cases in Albany County and we need more PPE or something, then that's a lot smaller amount than a construction project. So to tell you or to give you advice on what percentage, I don't exactly know at this point.
Okay.
You could start with a 5 or a 10%, just because I like those numbers.
Right.
They're usually pretty easy to deal with. But this money's tough. I mean, I've done lots and lots of reading, and it's tough. No, hardly any guidance. There's only some. I'm still waiting for final rules to come out. I just got an email back because I did ask a question out there. Of course, they didn't answer my question. And the final rules won't be coming out anytime soon, is basically what they said. So,
Yeah.
like they should have.
Yeah.
But I do like the prioritizing, so we don't have people thinking that they may be at the top of the list and they get their hopes up and then all of a sudden, nope, like that's not what we want to spend this money on. I think it kind of gives everybody a little bit of guidance of what direction you guys are looking to go in. And then it kind of just helps everybody save time that they wouldn't waste during some of these projects.
Sure.
Now, I'm not saying that, this is the end all be all, like there could be other funding out there. It's just a different thing and it's going to take more time to find and there may not be in the future. So I don't know.
Yeah. Do you have any sense of, I know the state got money in addition to us, right? And I thought that they might be working on broadband. I had heard rumors about that. Do you have any sense of that?
I have not heard they're working on broadband with that money. I've
Okay.
heard they worked on broadband with some other money. Through Wyoming Business Council, I think they were heading that. However, that's a very competitive application is what I've been told.
Yeah.
I do know from an insider information that with the states getting, I believe, over $1 billion and quite a bit's going to revenue replacement of theirs.
Yeah.
I do know the city of Laramie did not get this money. Only Cheyenne and Casper got it. So then they would be dependent upon the state. And from what I heard, the state is at this point has not said they were going to fund the rest of the cities through that money. But that was just what I heard a couple of weeks ago. It could be different today. So.
Yeah. Yeah. I'd heard the state or the city got some, but they were concerned about further reductions. So they didn't feel as able to spend it as maybe we did. Because they're not really sure what's going to happen to their funding from the state, but I could be just a rumor.
Well, and they have more rules set on
Right,
their funding
right.
because then it is a pass through to the state, where ours is directly from the federal government. So ours has a little bit more leniency. The one thing that is tough, I mean, in grants, there's usually a rule book basically, and you follow it. And it's very black and white, and this is not. This is a lot of open for interpretation. But if you don't have the same thought as what's going on at the federal level, that's when we could get in trouble. And I'm trying to have us avoid that at all costs. So I'm being a little more cautious, I think, than I should. But I don't want us to get in trouble with this funding because I think it could easily happen.
Right.
So
Super.
those are my thoughts.
Thanks. I appreciate
Yeah.
it. Yeah, go ahead, Tracy, please.
I kind of recall, and Jackie, maybe you can help me, and Kayla and Sunny, because we were all at Waco
Uh-huh.
last week, and I want to say that Governor Gordon mentioned broadband, but I can't speak with certainty that it was with the ARPA funding,
Okay.
kind of like what Bailey said.
Yeah,
We did talk about it.
I can make a quick email to the WCCA and find out where that's headed, and I'll make myself a little note. Sue, did you?
Yeah, I was there through Zoom, and I remember something about ARPA and broadband because Heber and I were having an exchange, and I also asked if we apply for if we use ARPA funds, can we also apply for another grant that was out there that they talked about for broadband as well? And want to reach out to Jeremy with the
Okay,
WCCA and ask if you can double dip.
okay. Well, I guess I'm just going to start down this path since we already have some expenditure with Adam. And I know that, Adam, I read in here, it says, fund projects to deliver reliable service with minimum 100 megabits per second download, 100 megabits per second upload speeds unless impracticable. So like what we've spent, let's say we were to do that to Rock River and Centennial and Tie Siding, what are you looking at?
So those are the minimums as of where they stand now. But if you read continually, they actually want to see you at more of a 200 service.
Okay.
Going forward. The cost there, it's different for every location, of course, especially trying to get a service provider. We're currently working on solutions for Rock River right now with the ISP. Visionary, thank you. And so I added enough in there that I believe would cover the Rock River in the continuum of our contract.
Okay.
I didn't have anything planned for Centennial or Tie Siding in terms of, because we don't have locations, I suppose, or at least a base infrastructure to support. I would need facilities and or something to locate those services to then branch a part of, or become a part of. So that's as far as I've taken it so far, and that's the request that's sitting before you, and the amount left against the project is essentially what I believe will be the Rock River needs.
Okay, and so what I've got 509,000, is that total? I can't remember, or is there still like 100?
So there's 140 remaining
Okay.
amount needed. And that's the service set as well as public accessible APs to provide the public access at those sites.
Okay. Awesome.
So
Do anything? Do you have anything with
I
Right.
don't know.
yeah, so to get it done, we're looking at $700,000 for the broadband that we have planned at this point.
exactly.
Okay.
Yep.
Cool. Well, thanks, Adam. I appreciate that. Will that deliver the 100 megabits per second to all those places, or
Yes.
200 megabits?
Yes.
Awesome.
Yes. No, I can't move forward if I'm not hitting at least above the minimums.
Okay.
To have that future proof. If you guys recall, you're actually with the service contract for all the sites planned. It's 5 years at 1 gig, and then it's actually an increase of 10. So it actually jumps to 10 gig interlinks and inbound, outbound at year 5. So
Okay.
you are well beyond the minimums and future proofing all in the same stead.
Okay. Well, thanks. I don't have anything else. Sue, how do you want to go down the list? Do you want to set goals, or how would you like? Because it appears
Well,
like,
I'd like to hear from some of these who have submitted more than a few things, like David and Luke, and see if they prioritize theirs a little bit. Because I know what I would like to have their priorities be, but it may not be what you would like.
David or Luke, either one want to take the on the hot seat in the Shark Tank?
So I prioritize mine as they're listed. So those are my priorities.
Okay,
But obviously, I mean, to you guys, I'm not chomping at the bit to, go ahead with all these, or, one or two would be fine. I think we've got lots of stuff going on in our office right now. So, but, over the period of time, we'd like to, get some projects done for the county that you guys think are appropriate. So,
Okay. Luke, thank you.
Good afternoon. I guess where I'd start out with on those pillars that you spoke of, it's difficult with volunteer service that we are, because personnel, and also, we rely so heavily on donations. So to do a 1-on-1 in terms of comparison of decreased revenue is tough. Our donations are down for sure, but personnel is definitely down. And so I think a lot of my priorities relate to safety. And so, to try to answer your question, the big things in my mind that are highest on priority are going to be safety related, both for the physical and emotional well-being of our people. So ADA restrooms and employee assistance programs are both very high. And then I divert basically to UV lights, PPE, and laundry facilities as kind of the next big category that I'd really like to emphasize on. As you know, we've had some changes in the last week or so that may impact some of these needs as well, that we're still trying to sort through how we want to mitigate some of those deals. But if some of these things change, I'll let you know in terms of if they get funded through other revenues. After that, I've got ventilation systems, backup generators, and then AEDs and monitors. I would like to say that communications upgrade is a very high priority for us as a district, but I'm not really sure how to tackle that. And the reason why I say that is because it's something that's used both with the fire service, but also the sheriff's office as well. And I haven't had a chance yet to talk to Sheriff Applehans about how we might be able to communicate what our needs are through WildLink. And because this really, we didn't do a good job of really communicating that, of our communication upgrade needs, because that has to do with drop radio communications up in the mountains particularly. So that's a much bigger picture than I really did it justice last time we met. And I need to reach out to the sheriff's office to find out if we're just the two players in this, and that we need to meet with WildLink or how we go about really tackling that problem. So I kind of have to table that, I guess.
Okay, the communications.
Yeah.
How about the breathing air compressors? Was that a second level priority or?
Yeah, I put that with the PPE and basically physical protection.
And the ventilation systems would be?
I have that as number 7.
Okay.
So ventilation systems is in the same category as backup generators as well.
Okay, could you just go down that list?
Sure, absolutely.
And just give us the numbers, because I didn't do it right.
Yeah, I did it in Griffins. I apologize. You're good. So employee assistance program I have is 1.
Okay.
ADA bathrooms, restrooms is number 2.
Okay.
UV lights is number 3.
Okay.
PPE is number 4. Laundry facilities is number 5. Breathing compressors is number 6. Backup generators number 7. Ventilation's number 8. And then again, AEDs monitors number 9. And then communications upgrades is number 10. And again, those are communications upgrades is very important, and it falls, in my mind, it falls along the lines of broadband. But I need to get a better package in terms of how to communicate that with you, what our needs are, what that financially looks like. It's a much bigger piece than I was understanding last time.
Okay. And communication now is just through radio. Is that
correct?
Yeah. And cell phone, I'm guessing somebody has cell phone.
Yeah, cell phones, but primarily radios.
Okay.
How we communicate. If you're up at Foxborough or Fox Park or, some of those places, there's zero comms. I've known about it for a long time, but I haven't had to, until that Mullen fire, I didn't really know the magnitude of the problem. And it was really addressed during the Mullen fire. And then Blake, as he was going through and trying to figure out the mitigation process after the fact, he started documenting and really recording all the dead air spots that we have up there. And it's really starting to be, I don't even like daunting.
Right.
So
Yeah. I know that we've gone through EMA occasionally through radios for Homeland Security, but I don't know what that looks like. It looks like you have something.
that might be the best avenue for sure.
Yeah.
I had a question for Luke.
Yeah.
if That's okay.
Yeah.
Luke, have you guys looked at doing any forms of like a radio coverage analytics? or have some sort of spectrum test done up there. I know we did it here in the courthouse with the Wi-Fi to essentially, and there are companies that'll come out and essentially track those areas to see what you can pick up and where you can't. And maybe even something internally. I know there's several pretty savvy radio hands in the pocket there. So
Okay.
something maybe as a starting point to help you there.
Yeah, I appreciate that. Again, that's a little bit outside of my own knowledge base. So I appreciate you reaching out like that. I guess I would defer that to EMA. And I know that they're in a transition right now, trying to figure out who's going to be the new Blake. So I've reached out to Amy, who was Blake prior to find out what avenues that she would have taken or has done in the past. I plan on meeting with her later on this week and the next week as well. But until that position's kind of filled, EMA's, I don't know how to go about communicating with EMA at this point. So hopefully that will be resolved, and I'll reach out to Katie in the future, or at least for now.
Thank you. Luke, anything? Sue?
No, I'm really pleased to see what you prioritize, Luke, because that's basically what I had too.
Awesome.
At least your first two. So
Yeah, and if you just remind me, the employee assistance program, was that mental health?
It is.
Access.
Yes. Yep. Exactly.
Yeah, and there is money for that. One of these objectives talks about mental health and behavioral health care under the support public health response. So it gives us an opportunity to do some interesting things in this community, I think. But let's see. Yeah, good. Thank you.
You bet.
Appreciate it. Yeah, Rachel, come on up.
I just have a quick question, and maybe process question
Sure.
about just a timeline, or if there'd be options to submit additional ideas or new ideas. I know after we left last meeting, and kind of looking at it, especially like some of, hearing about some of this is like wanting to address the systemic challenges, just knowing that those take more than a weekend to build. And so I know I definitely defaulted to like, these are the projects that we kind of already talked about at some point. I can put figures together and present.
Yeah.
After the fact, I know Kim and I have had some conversations about ways that public health and the library could work together. Evelyn and I have had some conversations about some of the things that might be helpful within the nonprofit community, but also helpful, I think, from the library, building partnerships and networks. So just kind of wanted to know too, if there'd be a way for, I know we needed a bit more time to kind of solidify some ideas and concepts, but if there would just be a way for us to bring those forward and some alternative ideas that frankly, like I would probably rate some of them above what I put, kind of gave you guys initially.
Go ahead, Sue.
I don't have a problem with that, especially because I did meet with Rachel recently. And she had proposed an idea between Kim and between public health and the public library that would be good use of funds and helping two entities, actually. And it falls under public health, and I think under the whole realm of reaching out to some populations that haven't had that attention of late because of COVID.
Yeah. So I mean, Kim and I have talked about doing a public health library partnership focusing on birth to 5 and supporting both those kids and their caregivers. And just sort of seeing that was a gap. So all of that early childhood education that would normally happen in person in COVID just kind of fell off. And so trying to get all of those kids back into the system and being asked and those caregivers, getting that support back up and running had been the idea. And then I know, Evelyn and the nonprofits, and this actually came up on our nonprofit call that the library also sits on, of looking at some better data sources, some better data databases. And Evelyn is here and can speak to this better than I can. But some of the stuff that United Way is working on that might actually give our nonprofits a better knowledge base and to actually more systematically and better address if there's an upcoming issue, to strengthen that network that exists between those nonprofits, which really does feel like it sits on some of the systemic challenges that this grant wants to hit. And I think in my mind, as the way that Wyoming is set up, that those systemic challenges are addressed by our nonprofits in our community more than they're addressed by our government entities. And so, just trying to find a way that we can make sure that we're that. And I mean, as the library, we're really an active partner and happy to really partner in that. But want to make sure that we have that room to come up with those ideas because they just take a little bit more time when we start pulling in lots of organizations.
Yeah, I can't imagine we would sit here in the next month and divvy out $7.5 million and say we're done, right? Because I think some projects will warrant immediate funding. They're ready to go.
Sure.
Broadband was off the ready to go on the rails. And some just won't, just kind of like you're just talking about it. And my reading of these rules really stresses the unequal impacts of COVID among disadvantaged folks. And so for me, I'm going to look at things in that lens, at least for part of it, right? I mean, and a percentage of it, because that's how it's written. And I think we get ourselves into less hot water if we always are. We can justify and say, hey, we worked with the library on this 0 to 5 they were reached out to nonprofits that deal with that, and they hit low income folks, right? Primarily, not everybody, but low income folks were were part of that population. So.
Okay, cool. I mean, so for that process, and I know this is maybe Bailey, Jackie, do you guys just, as we kind of have ideas, do you want us to just send in those to Bailey?
You bet.
I think as ideas, thoughts come in, send them to me, because I've been keeping this spreadsheet. I keep updating it probably weekly. Then it just, everything's in one place. It's not spread out over the entire county. And these are federal funds, so we want to make sure we're treating them like we should be. So.
Okay. Yeah, that sounds great. So as we get those ideas together, we will shoot them Bailey's way.
Yeah, and if you can, and just to everybody in the room, if you guys can keep us posted, say, hey, we've got this idea. It's not fully ready to be hatched yet, but it's kind of where we're thinking. Just keep us in that loop so that we don't allocate it all in the next year. And when it took 1.5 years to come up with this really great idea. So I think that's an important piece. Well, I'm just going to go around, and if you guys can do like 5 minutes for us. So we can have an understanding of anything, if anything's changed. It's nice to hear Luke and Dave talk about their stuff, but Chelsea, could you tell us a little bit about the imagery and how that impacts kind of your office, and then if there are sheriff's office or somebody else would be impacted by that? It would be really interesting to hear that.
Yes, I would love to. So Eagle View, as you know, is a overhead imagery that gives you a 360-degree view of the buildings on each parcel. I sent you guys, I did get the actual quote from Eagle View, and I believe I sent it in an email. For me, the goal would be to fly 3 times over the next 6 years. There's a lot of benefits to that, because then you can see the amount of growth that's happening over time. If we have a natural disaster, then we can see the impact that disaster has. The great thing about Eagle View is that if, let's say we have another fire, they will come and fly over that damaged area for free based on that contract. And that data would be incredible. Not only for the assessor's office, but for EMA and fire and lots of different entities. So for us specifically, we got the imagery in 2020, and it was just flown over the city. And we were able to add $1.4 million to the tax roll just from that single fly over the city. So this has the capability to bring money back to our county. I feel like it would be more beneficial to fly the county, because there are very remote areas that we can't get to. And so we can't necessarily do our job without that imagery. And I'm sure there are a lot of buildings that we don't even have. I know that when I reviewed North County, I would just take random roads and I found buildings that were built like in the 60s that we weren't taxing. So that would be another benefit for our office. Sorry, I'm trying to find my paperwork here.
You know, are those, with these flyovers, I'm trying to remember the email you sent to me and I'm not having a great time recalling. Is that every year for 3 years or is that like every 2 years, 3 flyovers?
Every 2 years, 1 fly.
Okay, yeah.
So it would be over a 6-year span.
okay. And is there something with 3 flies that you could do that you couldn't do with like 2 flyovers? What would you tell me about that?
I'm sorry, ask that again.
So if we just did 2 flyovers every 2 years, instead of 3 flyovers, what would we be missing out between 2 and 3 that would be helpful to you?
Is that even an offer from Eagle View?
I'm sure it is. I'm sure that we could pick to do 2 flies over the next 4 years. I
Yeah.
didn't get a quote on that. Beggars can't be choosers, so I would take whatever. But
Yeah.
The benefit of having the 6 years worth of history is just so that you can see the growth that's happening throughout the county. And to have that historical imagery is pretty amazing in itself. Our county is actually growing pretty quick. There's lots of new subdivisions moving in. Buildings are going up like crazy. So I think, and this project could be used for multiple departments.
Right.
I really think it would help with sheriffs and response if they could know, I don't know how they respond, but if they could actually see a 360 view of the building before they arrived, then they could know all of the entry points and exit points of that building. This information that we have on the city has been shared with the SWAT team. And so I know that they use it. We're in the process of getting it to the Laramie Fire Department. And also we've given it to 911 dispatch so that when a call comes in, the building will pop up immediately. So then they can describe, hey, the person is actually standing, in front of a hospital, right by the emergency exit, and they can describe exactly where that person is located.
Do anything? Could you talk to me a little bit about like, instead of 2 years, would you fly every 3 years? Or do you think the growth warrants every 2 years?
I think every 2 years is fine.
Okay.
That's typically the plan that these flight companies do. They don't do it every year. They do it on a rotating 2-year cycle.
Okay.
So.
And I guess Luke, I saw you shaking your head and I can't see Sheriff from behind Chelsea, but this is something that'd be useful to you.
Yeah.
Yeah.
I've used that program in the past for emergency response, and it's extremely valuable from a fire perspective. It does come with caveats in terms of that imagery needs to be able to be accessed from like a fire engine.
Right.
And so, it kind of goes down a little bit of a rabbit hole in terms of making sure that engine then has the infrastructure and the tablet to be able to access the information.
Right.
But I'm sure, especially this day and age, there's probably multiple avenues to do that. But the information that Eagle View gathers for a first responder or law enforcement is truly invaluable.
Okay, cool. And Sheriff, same for you. Have you used Eagle View that way?
We haven't used Eagle View.
Right.
We use a different mapping program than our records management system. Have that available. If we could get it available.
Yeah. Yeah. Okay. And Dave, how about rural addressing and that type of stuff? Would this be useful in that regard or no?
Yeah, it would be. We use just kind of a regular imagery quite a bit, like when we get updated, you can see, of course, the rise, you can see where new buildings show up that we didn't know they're there. And sometimes the imagery is not as good, but this Eagle View stuff is so good, you can really see what, it's not just somebody's, pickup truck you're looking at. You're looking at a new structure and what's going on. Actually, I think I was on Eagle View the other day looking at a property and noticed that there was some construction that was going on at the time that the picture was taken that we didn't know about. So So yeah, for enforcement wise, addressing as well, still see what's going on out there. Yeah, it's really amazing.
And will they host this for like public to look at or no? It'd just be an internal?
Just an internal government.
Okay.
Yeah.
Okay. Fair enough. I'm out of questions, Sue.
No, I just like the idea of so many departments benefiting from one expense here.
Right.
And I was here to see that demonstration. It's incredible. It's
Yeah.
just so detailed.
Yes. They did say that they would be happy to come in and do another presentation if you would like to see that. Pete.
Okay. Okay. I've gone online and I've read through this stuff and looked at the stuff that you had, and I think I was up there, but it wouldn't hurt to see it again, maybe. At least maybe just online to show us. They don't have to come here in person if they don't want to.
Okay.
But yeah.
Yeah.
Awesome.
They do both.
Thanks, Chelsea.
All right, thank you.
I'm just going to move around the room. So do you have anything to add that I know it's putting you in charge of speaking for the nonprofits is, yeah.
Spot.
Right, yeah. Spot.
And Rachel was like, you should come to this. Like,
Yeah.
okay.
Yeah,
Yeah, so just to add to what Rachel said, I think that there's a lot of partnerships that could happen through this funding with some of the proposed areas. Our nonprofits really do focus and reach that population that has been really hit hard by COVID. And the database that she spoke about, or the collection of data, one of the things that nonprofits are really good about is telling the story and reporting based on the grants that they have and the services that they provide through those grants. But we don't necessarily have a baseline of everything that's happening in our community. And I don't like the word needs assessment because everybody does needs assessments, but they're all over the place and across the board. So how can we pull that information together and provide not only our nonprofits, but our county information on actually where we lie and how these communities have actually been impacted? And that's something that United Way has been looking at for the past couple months. And unfortunately, we don't have the funds to get that new original data. And so we've been trying to figure it out with as little as possible. And so Rachel and I were talking about perhaps presenting it through the ARPA funds, is that collection of data, putting everything together so that anyone in the community can use it, could see it. It would leverage additional funds for nonprofits and additional opportunities out there. Hey? So that's what Rachel was kind of touching on. But really just representing the nonprofits because they are on that front line of individuals who are impacted by COVID. Yeah.
any questions, Sue?
Yeah, kind of. No numbers, no.
Right.
But as Rachel said, if we had some time to put something together, that we would love to bring that to you.
And do you think, I talked to you and I might have thrown it by the nonprofits to get their response, and we maybe ought to do, I should probably make it more formal with them. Like, should we have a granting program? Does that become more work for Bailey? I'm not sure about that. Should there be a project that everybody would get on board with?
Yeah.
That we couldn't do otherwise than having this ARPA funding? Is there some of both, right? Data collection, grant funding, granting, and then a project. What's your sense of that?
So I think that there's a couple different avenues down that road for nonprofits. There definitely would be the opportunity to have a granting program for them specific within the projects that they're working on in the community for these populations. There's also, and I've talked with some people before about this, that collective impact coalition that's coming together and addressing data and looking to see if there's one area that we could start to look at to solve a systemic issue within health and social services. An example being, and I'm just going to go to Rachel's, right? Our early education rates are lower than national averages. They're lower than some other counties in the state as well. So is there something out there that we could do to move that number? And that coalition is voting down, and by November we'll have one specific area that they're focusing on. So there is that opportunity as well. And then the opportunity to grant out, and United Way would be more than happy to help with that process and getting money and funds out to the nonprofits.
With a coalition like that, Pete, I would rather just give an amount of money to them and they figure it out, spread it wherever they feel is needed, and not be micromanaging every little thing to us.
Yeah, the only thing I think is just we'll be responsible for the reporting of that. So somehow we'll have to figure out.
Well, you guys could coordinate.
Yeah, Bailey, you had a thought on it.
I have a suggestion.
Sure.
Back in December, we basically kind of did something very similar to this. We were given money real quick. We had to get it out really quick. So I created an application process for any nonprofit to apply for. Then that let us kind of see, okay, what are they kind of thinking of spending this money on? Is that okay with the grant? And then we gave the approval, and you guys even went through and checked everything off.
Yeah.
So we could do something like that, give an opportunity to nonprofits. You speak for the nonprofits, I do not.
Yeah.
Where you're involved. One thing I've been noticing is, I mean, even with that money, I turned money away. I sent money back to the state with that money. So I don't know how much is needed right at this moment, but yes, I think they should have the opportunity to, receive some of this funding if that's what they want. I'm just not sure how much they really want right now.
Yeah.
Is my only thought.
And I can speak a little bit to that. I think some of that is an education process, knowing what's available and that they can apply for it. I think some of it is also they're short-staffed, right? They're functioning with one person to write all of their grants, to run their program, to manage everything of that organization. And so I think if we can ease the process for them, that they might be more readily available and able to get and apply for some of those funding areas. But yeah, a lot of them, the average like nonprofit, smaller nonprofit, right? 5 maybe, not even full-time people. So you do have an issue of just time spent doing things and knowledge and accessibility.
Yeah.
Evelyn, how big is your coalition right now?
So right now it's 15 members. The goal is to get to 25. They just had a talk in the recruiting based on census data. So we've broken down the census between age group, sexual orientation, religion, employment, and we're hoping to fill it based on county information. So it reflects the voices in the county. So 15 now, 25 in the end.
Heber, any questions or thoughts?
I'm with Commissioner Ibero on this, that I'm for a block grant that, that they could go access. Of course, that doesn't remove accounting from the responsibility part, but from the process part, maybe to some degree. I just don't know how much that is. Right.
Yeah.
So, well, super, Evelyn, and just Bailey, with that money that came out last year at the end of the year, if you weren't able to work over Christmas break or you were on vacation, you didn't get her done. And I know because I worked on Christmas Eve on that thing. And so, I'm sure there wasn't the need, which I know you know. I just think there wasn't the capacity and to understand what was able to be asked for, and then to actually do the, hey, I'm going to go through my books and see, did that computer work or did it not work? So
I think it's fair to say that CARES was a really rushed challenge.
Yeah.
And ARPA is more patient.
Yeah. Well, thank you so much, Evelyn. I appreciate
absolutely.
it.
Thanks for the opportunity
You
to
bet.
speak on.
Yeah. Sheriff, can we talk with you a little bit here?
Is that a fair thing to say,
You
Mr.
bet.
Chairman? ARPA is
Well,
more patient.
it certainly seems like we have more time right now as it sits than we have with CARES Act. I think we had a month, maybe.
I think there was just such a need to do something right away. People were just so,
Sheriff, go on ahead with your requests here.
So for my requests, they're ordered as listed in terms of priority. ACDC medical contract is the #1 priority. Interview room AV is second, and then salary increases, premium pay for employees that work through COVID is the 3rd priority. So, but by far #1 is that ACDC medical contract in terms of describing the pillars that you've listed out as where this would fall out under is those underrepresented populations that had to deal with COVID, and also providing medical services for them as outlined in both the bill and the final rules through the Treasury Department. It's in there as well. obviously the AC/DC medical contract's ready to go. It's already been signed, approved, and they're already working within our facility. So using funding to pay for it. I think we all know that funding like this doesn't come around terribly too often in terms of lump sums. Being able to take a contract and basically have somebody else pay for it while we work on the next contract later on down the line is an opportunity that we're not always afforded or granted to. So that's what makes this kind of for our office, the number one priority. So it falls within not only the guidelines of the bill, but the timeline also falls directly within those guidelines of the bill as well, in terms of how long our contract is and when we're have to appropriate and spend this ARPA funding.
So it's a 2-year contract,
It is a 4-year.
4-year contract. Okay.
Commissioner Richard, anything? So I just have one question for you, and it's, a little bit out there. But I think about how we've had discussions with mental health about having different levels of service provided to ride along, whether that be telehealth or whether that be a mental health social worker to go along with you guys when it's your skill set isn't required. What do you think about something along those lines? Or do you think that that's a real possibility, or do you think that's just so far out from where we are that that's probably not something to consider?
Both. So it is a real possibility. I think what you're trying to allude to is maybe a special response team that goes out to calls that doesn't necessarily need a law enforcement response. And I do think there's a need for that in our community. And I do think there's potential to have one of those in our community. Having said that, we're far off from kind of getting there. There's basically 2 major issues. And if we wanted to use the funding for it, ARPA funding for it, it would help with one of those issues. The first issue is obviously funding. But the second issue would be finding the people willing to do the work. And that's twofold. We have plenty of people in town who want to do the work. We don't have plenty of people in town that would actually do the work. And the way I can explain that best is that the mental health crises that we go to and that we have to respond to rarely happen between 8 a.m. in the morning and 5 p.m. at night. So that's going to require, if you want to provide those mental health services, people certified in those mental health services to be able to respond after hours, nights, weekends, and holidays. And that's really kind of that barrier that you hit, is trying to find medical professionals that want to go out and do that work and you sustain that type of work after those hours. Yeah. And so we've seen models be made in a lot of different places. The closest is definitely Laramie County has a special response team. Most of that is funded through their hospital and then also through their county. Denver has another one as well, where they've allocated funding and gotten some grants as well to help out with that. But that's a large funding operation. Just to kind of give you an example, I mean, if we could hire counselors to come in possibly at the same pay as my deputies at $50,000 a year, work nights and weekends and do that work, I would be much more, I don't know what the word is, optimistic that we could turn that around real quick. I don't find a whole lot of medical professionals that want to work for that type of salary. Usually they want to work quite a bit higher. So we're dealing with one of those issues with the medical provider that we were looking to help supplement that jail medical contract within our own facility. So, like I said, if you wanted to dedicate that money to it, and the money's obviously there and we could do it, actually finding the people and building that program to get it on the ground, effective and actuated, those are three big gigantic steps. And in my opinion, I'm not exactly sure what the likeliness of that would be happening without the funds.
Okay.
So,
Yeah, I thought about this as possible seed money to start a program.
and it could,
But if it's too difficult, you know the biz more than I do.
we have our Albany County Mental Health Board is already trying to start to work through that. I know the city is kind of discussing that with their ad hoc oversight board as well. So those conversations have already started. But they're only in that kind of that conversation conception stage. So I said if we wanted to use it as seed money, I definitely wouldn't be opposed to it. What that number looks like and what's needed, like I said, we're a ways off.
Yeah.
Off of getting there. So,
Okay.
and like I said, one of the biggest issues that we have with that mental health crisis response team is all people-based.
Right.
Trying to find the people in our area that would do that work and sustain that work. So it's a challenge that Laramie faces on a lot of different fronts.
Does anybody do that with telehealth at all? As far as that piece of it, where somebody's on call remotely? Does it work like
even
that?
with that, we have challenges. So right now, basically, we use the national suicide hotline.
Right.
So, so actually having kind of a local response team. So we already have those challenges in law enforcement where, it's difficult to call somebody at 3 o'clock in the morning and say, I need you out here like yesterday.
Right.
to come and help us deal with that situation. And then going through all the other services that we have in here in terms of transporting to the hospital, getting them into behavioral health if they need to, or if it's a substance abuse problem, trying to find a facility. We don't really have a detox facility here in town, those types of things. And so, like I said, I'm all for trying to get people out of the jail,
Right.
trying to remove law enforcement for most of these response. You'll never hear me say different on that one. But like I said, the philosophy of it and actually doing it, there's a huge gap.
Yeah.
So in my opinion, we're a little bit farther away from that than I think we are. Like I said, there's a lot of nuts and bolts that go into it, not just figuring out what it is we want to do and the responses that we want to have. But like I said, actually finding bodies to get to that response level is one of the biggest issues that we have.
Well, thank you for that great conversation. Anybody else? Sure. Awesome.
I
Thanks.
have a question.
Sure.
In those programs where they do bridge that gap, are those people generally accompanied by law enforcement anyway?
In
Just
some
from the safety aspect?
in some instances, yes. In some instances, no. So in the Denver counties, no. They have a set number of calls that crisis team responds to that they don't need law enforcement. So law enforcement doesn't go with them.
So in dispatch, they decide based on the tension or the circumstances, whether whether they go accompany.
Yep. Laramie County has a hybrid model where one of two things happens. The call comes in and then either law enforcement responds and then the crisis response team comes afterwards, depending on the circumstances, or the crisis response team responds to the call if they have enough information. Law enforcement will go with them. And then depending on how it goes on scene, then law enforcement will leave or either stay. So, and that's part of the model that we are looking at here within the county as well with the initial conversations that we've been having, would be basically a joint response.
Right.
So, but in terms of the funding and the stuff that we looked at, there was a reason we didn't put that into any of our requests, either here or any of the other outside funding requests that we've had in the last couple of months. It's like I said, we're kind of far away from really making that an actuality. So, and to expand on kind of what Heber said, I think Denver, Denver put anywhere between 2 to 3 million into their program and rolled with it. So I know it's over $1 million in Laramie County as well. So those would be, if that is something that you guys are thinking about, that's would be some of the numbers that you'd be possibly playing with. So.
And Sheriff, when you say we're still a ways away from this, far away from this, is this solely financially or getting everybody on board, like, medical personnel and all? Just having that
for a crisis
tool.
response team, it's literally just initial conversations and looking at models in other counties and other cities. There's been no conversations of what the funding source would be, what that funding source would go to, who those people are, what calls that they would respond to, what hours that they would work, what areas that they would work. But none of that has happened yet. And that's why I said, yes, there's potential. There's definitely potential for it to happen. And it can happen in Laramie. But like I said, we're at an idea concept point right now. We're nowhere near basically the actuation. And so ACDC Medical is actually working right now. That we've bridged that entire gap, moved it all the way through. It is working and effective at that point. So that's why that's priority number one for us.
Could you tell me, did you budget the ACDC at this amount, at 640,000, or was it at 250,000 or
266,000?
And babies, we can't use this money to stuff that was budgeted, if I remember correctly. There's something sticking in my brain. But above that,
I think this is where me and Bailey disagree.
okay.
Based on our.
It's about supplanting, right?
Technically, it'd be supplanting. It's already budgeted. You can't do that. But
Yeah.
you and I had discussed at the department head meeting about
Right.
matching.
Right.
And this isn't a grant that requires a match, so
Right.
that's not a problem. We can use it as long as it's eligible. And I think from what Tracy and I did find, I think it is, I just couldn't go back, I couldn't find it where we found it in the first place. I think it is eligible.
Yeah.
But to my knowledge, it is also statutorily required, I believe. So it
Yeah.
is something we have to have in the future as well.
Right.
So I think you guys just need to keep that in mind, but I think, yes, I do believe that you can use some of the funds, just not the entire amount, because that would be considered supplanting.
And this is a part where me and Bailey
Yeah.
kind of disagree. So Bailey is 99.9% correct in terms of supplanting. In terms of federal grants, you usually cannot supplant funds that you've already budgeted.
Yeah.
This is the one you can.
Okay.
And it says that through there that you can use it for those things. It gives you plenty of examples in other areas as well. Premium pay is supplanting. It really is for the most part. So revenue losses essentially supplanting as well. And so they give you a bunch of different examples throughout that bill of being able to supplant. And like I said, every other federal bill, most of the time you can't even remotely approach that. But like we've seen through this bill and all the rules, they give you a ton of leeway in terms of what it is that you can use. So I have those pages in the final rules that I can give you guys in terms of the research that we did that says that it does say pretty explicitly in there that you can use it for incarceration facilities, medical for incarcerated facilities, and the populations in there. It bunches it up with not only jails, but then I don't know a good word for it, old folks homes.
Yeah.
And other basically, those static.
I've been incarcerated in one of those.
I don't want to equate the two. But basically kind of those static living situations in there. So
Yeah, either way, the medical contract will be covered. Whether general fund for 260 and then the other 380 comes out of this or whatever.
Right.
Yeah.
Like I said, we can talk to the particulars, but like I
Yeah.
said, in terms of what we were doing and we were looking at, money coming in, that's really our number one priority. And like you said, having the opportunity to have essentially the federal government pay for it.
Yeah.
Almost too good to pass up.
Right. Anybody else for Sheriff? Thanks, Sheriff. Appreciate it. And if you'd send that research you guys did about the supply thing, I would just be interested. Sure. Just to know. Yeah. Thank you. Kim, Bill. Thank you.
Yeah, thank you. So I was hoping to have more of a outline number for you guys, but currently we're in the process of getting an architect to come and give us actual quotes on what it would cost to either renovate our building or renovate the building that I've found to use. So I'm hoping in the next couple of weeks to get an accurate assessment on that. But for right now, it's still, our main draw is getting a new building. We have one in mind. I do know it is listed for $795 and it's empty. So I do know it would require a lot of planning and work to figure that out by having exam rooms and being able to house our needs. But I think it is a very important thing for us, for our community, to know that we have a big enough space that we could hold our COVID clinics and our flu clinics rather than going to other places, and that just be that permanent spot in the community that people know we're there, we can unionize, we can do everything there. So that being said, yeah, do you have questions for me right now?
Commissioner Richardson, Commissioner Rivera, any questions?
Hi.
I only have one comment, and that is
Yes.
that Albany County owns roads, right?
Yeah,
So if you're shoehorned into where you are, you don't plan for a building for the next 5 years, you plan for one for the next 30 years, whatever that means.
right.
Or
And
20
then,
or
you know,
something.
just thinking about
So-
everybody needing space, if we moved into the bigger building, we would have our building that the county owns for offices, meeting rooms as well.
That's just, generally, that's how
Right,
my commissioner brain approaches these things.
Yeah.
There's a solving the immediate issue, and
right,
you can probably only go so far beyond what the current needs are. When it's not 50%, it might only be 15% or some sort of functional, flexible space that can make that more possible later. But that's just something that I'd want you to think about when you're thinking about these things, because
okay,
if some millions get spent and we miss the mark, that's not good.
right, absolutely.
Yeah. Yeah, and the building that you've been thinking about, is there excess room for other county
Yes.
offices?
Yes, so we would be thinking WIC would obviously still come with us because we have a high population that works together, our maternal child health as well as WIC. And then if we needed to, like a prevention specialist as well, would be able to, I would think we'd be able to fit them in there for sure. So that's originally who I was thinking.
That sounds like a great idea, actually.
Yeah.
It'd be great to have prevention in with WIC, with public health. And,
Yeah.
and who else knows what else we'll dream up about public health.
Right.
Well, thank you. And then, so you're going to meet with an architect and say,
Yes.
let's say if this, they'll ask you, how many exam rooms would you need? And then what size of those exam rooms? And then
Right.
what's your conference room and all that stuff? And then you get an idea if that building will work for you or not. Is
Correct.
that how?
Correct.
Awesome.
Ooh. Oh, geez.
Yeah.
Okay.
Anything else?
Oh, the only other thing I'd say is that I think location matters, right? You have
Yes,
to be somewhere where the people who need to access can access.
right. So it's not too far from where we are now.
Mhm.
I mean, it's no secret. I'm looking at I guess it was the old boot barn. Is that what the boot barn? So it, just right down the street
right on Third there, good parking in the back, so.
Yeah.
I thought the location was pretty good.
Yeah. Awesome. Thank you, Kim.
Yes, thank you.
Jennifer, anything to add? I know Kurt's not here, but I'm sure you could talk to the virtual court supplies, and that's just audio visual.
It is to replace what's in Kurt's office now because it's not stellar. And then to also set up another essential virtual courtroom in the victim witness building where my office is now as well. So that there's a lot of transition now again back to doing hearings virtually to the extent that we can. So we can do them in front of our computers so long as we don't have witnesses. But when we have witnesses right now, the only facility we have to be able to do anything is at Kurt's desk.
Okay.
So that 7,500 is for 2 setups.
Okay. And those are mobile. Those are not going to stay. For instance, if somehow we leave the room, the place where we're renting,
Right.
those would be able to go with.
Right. It'd be mounted on the wall, so it was
Right.
out of the way, but it wouldn't be incorporated like built into where it couldn't move if we didn't have that spacing.
Yeah. Commissioner Barry,
And
Commissioner
it'd be
Richard.
exactly what you currently have, or is it an upgrade, or?
It's an upgrade, and we asked IT and Adam gave us a quote that has, he can certainly speak to it better, the better microphone and the better cameras for the court hearings.
Yeah, so it's actually a subset of some of the equipment that I'm putting in here. Either the same set, being the microphone array bar set, as well as the cameras. We could go with like a larger AVR, which is going to end up in here, or something that just gives a better focus control. So if you need to zoom and do all your things along that lines, it just turn them into more of a usable workspace. I believe Kurt's office is running on a secondary PC. It's just the internal speakers based off of an older television, and then an older 720p webcam. So it just overall it needs upgraded. And then the new location will be the exact same mirror copy so that there's no differences and they can approach it in the same direction. Does that help clear anything up? Perfect.
Commissioner Richardson, anything? Thanks, Jennifer.
You're welcome.
Jackie or Tracy or anybody from your offices? You have the revenue replacement, but is there anything? Right.
Upgrade here next to the election building, and the information that I provided was the quote that was given to me by Bill Gorman.
Okay. Okay. Commissioners, anything else? I'll tell you just kind of conversations I've been having. I sit on with the working group that I work with in the city. There'll be a presentation tonight, obviously, about the renewable energy group in Laramie. We have buildings here pretty closely co-located, and so a joint solar project to offset the costs of electricity of this building and the building we own, and maybe the court or the city hall, maybe the detention center, if that's someplace where it could happen. Those are funds that have one-time costs, but then offset costs going forward. So, and then IT also, every building that was nearby, to think about how we could coordinate those projects, maybe having a better rate on the amount of solar panels we buy, the conduit and all the electricity infrastructure that you need. And then maybe hold them out in a different way to ARE is trying to get bulk solar purchases to local individuals. Now, we wouldn't be involved in the purchase of that, but that would all come together and maybe we'd all get a better deal on solar panels. And then in the end, in 20 years, right, we're saving $500, $600, $700 a month in electricity. Yeah, Adam, you had a thought about that.
I just want to express that I'd love to see a battery bank at each of the facilities to
Yep.
increase the resiliency, especially if it's solar powered. which gives us, kind of a threefold approach there. I would support that hand over fist.
Yep, I'm fortunate enough to work at a place that has solar and battery. And we've used the battery twice and had private clinics come store their vaccines at our vaccine fridges because our battery is so reliable and so immediate in the switch over. So we all used it 2 or 3 times in 2 years, but because solar is amazing in this community. So that would be that for me. Would there be anything else from you guys?
Well, one thing that's not on this list, and Sue and I were discussing it during Waco, and that is broadband. ARPA funding can be used for that, but it takes, the long and short of it is that everyone likes the idea and there's money available. But it's hard to get somebody in a community to take the ball and not let it drop when you start the process. And generally, when it comes to state grants, for this type of stuff, they like to have a government entity be the sponsor of the project. And we dealt with that before, right? We were a pilot a couple of years ago, and they didn't know what to do with it, right?
Right.
I mean, we sent in our application, and in trying to apply or use our application, we were the first applicant. On the state side, on the Broadband Council, they didn't know how to deal with kind of the oversights in their own process. Our application made them discover all kinds of challenges. So it's something that I think we should do. And actually, Adam got us started off on our own, with that contract that we just did. And there's ways for us to use ARPA money to do that again. We just have to figure out how, research how.
Right.
And any one of us could call the broadband, the governor's broadband guy, the broadband council. Also, the contractors all know the program is better than the policy.
Right.
But the point is some hybrid between fiber and wireless and interconnection so that you can push big broadband out pretty far and inexpensively. Of course, that has all kinds of health, educational, business. There's all kinds of repercussions from that, consequences that are good.
Yeah.
It was interesting, the explanation. What did the guy say? He said the old time providers play defense, right? Because the feds look at it in terms of census block. So one little corner of a census block, I can provide, I'm CenturyLink, and I can provide some sort of passable coverage that passes for the entire census block. And then they go to the next one. And so then the feds don't want to fund something that says that it's already there, except that it's not really already there. And I remember about 3 years ago, the broadband guy moved to Washington State, but they had set up a way that you could test your own connection through their site so that they could get all of this metadata, basically, connection by connection, test by test. So they weren't looking at it in block graphs. It's like the old Verizon map, where it show all of Wyoming red. Like we cover all of Wyoming, so we all know that's not true. So somehow it has to do with the resolution of the picture. If the entire state of Wyoming is 1 pixel, then I guess we're all covered. Anyway, the point is that now these kinds of funds are being, finally policymakers have understood that other types, redundant broadband that's faster and can get built over people who sort of already have or defend that space. So it's not like, it's like the rotary dial phone people trying to keep the cell people out. That's basically it, based on some federal sort of. You get what I'm saying?
Yeah.
So that is not such an obstacle anymore. And that was the obstacle for rural states. Because then somebody says, don't grant money there. We already covered that. Except they don't.
Right.
Or they do. You move 2 safe brushes to the right and stand under that. And that's not reliable enough for business or health or education. So that is
I came
something
out of
that's
there,
right.
People feeling their strong support for broadband throughout the state.
Yeah, well, everybody understands the needs, like to make Wyoming have a tax base and grow, takes 2 things, and that's data, broadband and air travel. And those are really big challenges for a real estate like this. But this money specifically can be used for that. So before we let it go without using it, we got to go figure out how to do that.
Okay. So I guess my thought is we'll go just down the list instead of trying to figure out what we should put in each pot. Maybe we should say to everybody, hey, these are interesting projects for us. Could you find out a little more about them? And some people probably have already done that work, but probably some people have said, well, these are just our ideas. And since you're interested in moving forward, then they could parse out what the actual cost might be. Does that sound like a reasonable approach to this? Okay, so,
I'm making notes next to the ones that I think are done, like not controversial at all, because I'm trying to sort them here.
cool. So we'll just go down with just as they're listed with the virtual court supplies. Is that something that is interesting to you? And Sue's shaking her head, yes. Yeah, okay. Okay, so then we'll work through Adam's requests here. I'll just read them off. You tell me which ones you think are or what you would like to work to give advice to Adam to work on. County facility, public broadband access points. That's already being done. Sorry. New firewalls, gym memberships for all AC employees, smart signs for county facilities, new county facility. Yeah, that's kind of a Kim thing too. So we'll put that under Kim.
The ones in green, definitely. And I mean, as far as county, public broadband access points, we might be able to broaden that a little bit too. I don't know if we need to, because I think he did pretty well. One of the thoughts I have is the library and whatever they're pushing out, and I don't know if they can help with that.
The library's already on a fiber link connection, and I believe it's at a gig. So it's outside of the scope of the available funds.
They're already doing that.
Yes.
So would you agree with agree?
Yeah, yes.
That's all.
Sure.
I think probably where there's the most room for partnership would be Rock River and Centennial. Centennial being, our building in Centennial is not a county building. We maintain an MOU with the nonprofit that owns the building to have, and we provide the internet access that is not at a gig. So there could be partnership there. We did put internet expansion down under the library as well. So that was not for so the Laramie branch, we're at a gig fiber, so that's fine. That was to strengthen our Wi-Fi so that we pushed all the way to the end of our block. And then that was also to include hotspots and tablets that had Wi-Fi network. So primarily off of our bookmobile, so that we could be able to check hotspots out to people so that they're able to take those spots that don't have access. If they don't have access in their home, we're able to essentially check the internet access out to people to take home and use.
So are those things are they in your budget already, or can they be in this?
They're in this. They're in that.
We're just not to that point.
We're not to that point yet, but they're included under that the internet expansion line. And I think there's room. I mean, Adam, I can definitely talk and coordinate and make sure that we're coordinating where we can.
I think the easiest one to grab at this point, as long as we make good progress, would be the Rock River, just because the central location that we're looking at is 2 blocks up from City Hall.
Yeah.
Essentially for Rock River and the services that the library is providing. But that's the whole point of trying to get a partnership backing with, a provider using our government base, is to pull these services in so that you see a growth base in the next 2 to 3 years. Where they start building out because they already have an anchor location. And that's really the big picture that needs to be driven home. It's not even just our services, but the fact that you hope to be an anchor for continual growth, right?
Sure, so that makes me think of the school district and the county together. Like you take Harmony School or Centennial School, because lots of places in Wyoming, the only place where they have an internet blowtorch is the school. You get people parking outside the school, right? Trying to make their stuff work so they can, order something or have a Zoom call in the parking lot outside the school and in rural Wyoming. So it seems to me that somehow we just have to figure out what the rules are and what the process is and the funding streams so that we can do that. Because I actually think that if, since they like us to be the applicant, and I think that school districts are sort of fit the bill too, but there might be a way to combine those or to make them work together so that the last mile for the provider is out to all of the residences out there, because there's some backbone that gets pushed in there, by the school district and the county. That's just my thought.
Bailey, do you know if the school districts got this ARPA funding? I'm trying to think they did, but I don't remember.
I do not know.
Yeah.
I could reach out if you'd like me to.
That'd be great. Yeah, thanks. I just can't remember the reading. I think there was money from this for school districts, but yeah.
That may
Shouldn't go on that.
They're a good anchor partner.
Yeah,
A lot of
yeah.
cases, they may not already fit the current guidelines, but again, pairing so that maybe we see that growth is always a good idea.
Okay, so we'll do the green with Adam. And then and not the yellow or the red at this point, to instruct him to give us a little more advice. Is that how I'm hearing it?
Yes.
Super.
To be clear, what else do you need on the green?
If you're ready to go, right, like if this just wasn't a concept, but you had done all the research.
Yep.
Cool, you're ready to go as far as I'm concerned.
Yeah,
I'm guessing some people just put concepts out for us.
Okay.
So this will try to narrow their focus, like Luke has like 10 here. We might narrow his focus on 2 or 3 that we might consider right away, right? And then then he can give us more information on that if we need it.
Understood. Thank you for the clarity.
You bet, you bet. All right, David has Albany County wastewater regulations update, code enforcement, aquifer protection, area enhanced wastewater incentive, rural broadband plan. I think David was helping us out with ideas on that rural broadband. Is that what you're thinking? Or are you thinking something different than what Rachel and Adam have both supposed?
I'm not sure exactly what they're really doing. My idea was to kind of map the county to determine where we have broadband and where we don't. And maybe that's what they're trying to do. This isn't a big priority on my list.
Okay.
I mean, if this is being done other places, I don't really care. And it might be something we do in the future too. If we don't have the information, we can look for funding somewhere else. Right. But like I said, it's low on my list.
Okay. Yeah.
Mr. Chairman, to be clear, I didn't suggest who should lead it. I just know that it's something that we got to figure out how to do.
Yeah.
So there's sort of the money and policy part, and then there's the physical part, like David was talking about. And I'm going to guess that GIS, that there's a way we already have in our data. There might even be a map layer that exists already that shows utility easements everywhere in the city, outside the city, pipeline easements, railroad, because if you're going to get something that's fiber somewhere, I mean, you don't need an easement for wireless, but you need an easement for fiber.
Yeah, Adam, does this already exist or?
It's not. So I would say your the momentum going forward, especially when you want to get into the communities that don't have an established county facility, this would be critical. This would give you, if I envision this, it would be essentially an evaluation based on the broadband options that we have in certain areas. It would then prioritize the low growth or expanding growth areas that are going to need to see either input or capacity increases or coverage increases. And it's not just coverage, right? You have an old site that is at capacity and can't sustain more. That needs to be addressed at the same time for places that have no coverage. I would take something like that and I would prioritize it. And I'm not trying to put work on David by any means. But I think that would be critical in those conversations with, the different partners to then apply this funding. I mean, you can't like you said, no one has a know what is covered and what isn't. But if we can draft up here's where we're at, here's where we would like to be, then you start pulling it in, and then you start getting wheels to the ground and you start moving it forward.
Those companies know where their stuff is.
They know, yeah.
Yeah.
And they normally know where other people are as well.
Yeah.
But you still have to approach that and give a vision for them to accomplish, especially if you're looking for that partnership when you're trying to drive the ball, not just their sales department.
Yeah. And the plan would be more than just, identifying these areas, but it could look into funding options and, collaborations and bidding standards. If we did go forward with this, I think I would tap into Adam because I really am clueless when it comes to broadband. I just know that it's a big thing and some people don't have it.
It's interesting.
And it was on the list of things you could ask for. So I put it down.
So under the green on David, is everybody on board with the green under David? Okay.
Definitely.
Yes, what's interesting about that is that all of those things, the industry already knows. They know all the coverages, they know its capacity, if they know all of those things. The question is, how do we reach out and work with the industry without appearing to prefer one company over another? That's the challenge. But if we duplicated all that work, we probably wouldn't do as good of a job, and it would take time and money.
Programs that they know, especially when we thought fiber was running for a little bit, they had to run it. And we're literally across. So I would maybe not take for granted that they actually
But they don't count.
So aerial imagery with Chelsea's
Yes.
group. Okay. You on Heber, are you on board with that?
Totally.
Okay, the public health building with Kim. Now, I'm guessing this is probably going to incur some cost that we might not recoup. For instance, this architect's probably not coming for free. And if we don't head down that path, maybe can we?
Kim has approached me about this, and this is a project Ryan and I had even talked about before. So I do have some money in my budget. I've already told Kim that I would pay for Jake, his time in it, and the architect up at this point. If we move any further than that, then I'll need to figure something else out. But I do have some money in my budget to do those two items.
Super. Awesome. So is everybody on board with that deal?
Mm-hmm.
Yes, it's never going to get any better. It's only going to get worse.
Rebecca is not here. I don't see her online. We'll have to just table that one. Revenue replacement with Tracy. Yeah. Yeah, I'm all for it. Yeah. Do you think this is only going to be a one-time? I think this money's over 2024. So this is just for this past year, probably.
I
Right?
have 3 years are figured in that 750,000.
Okay.
So as the years go by, if we can't use them or we don't use the full amount, we can re-release that money for other uses.
Okay.
But it also opens up additional uses for the revenue replacement if we can't use it.
Yeah, super. Thank you, Tracy. So Rachel's pay differential, internet expansion, lost revenue, updated water fountains, green, all of that. Where's everybody sitting? Sue?
I think I want to wait to see what Rachel comes back with as far as what your priorities are. Would you rather see something going with public health or that program than?
I mean, it's hard because it's like, you could also, course, the answer is always gonna be like all of the above.
Yeah.
Because I think, I do think the pay differential for staff, I think will go a long way, especially for the library. Giving some equity to library staff that staff of RBC. Internet expansion is definitely come back with more detail on what that looks like. That was a pretty broad. Same with water fountains. I think lost revenue is definitely a real priority. Because I think we have other sources. I think if I were, for me, actually, I think for this funding, I would put the pay differential, the water fountains, plus the partnership with public health, probably the top of my list. I think internet expansion is really important, and it's what I want to do. It's one I think I could find funding for. So I think that to me becomes, it's harder to find that infrastructure funding, so like water fountains, it's harder to find a. Is internet expansion, I think going with that funding. So for me, I kind of prioritize not what is most important, but what I think is harder to fund elsewhere. So I think that, and then I think the ideal of public health, I think it would be really great to have some funding. And then I think we'd be ready to, that would get us going, and then we'd be able to rock and roll and get some other funding.
Commissioners, are you on board with pay differential and water fountains? To at least get more information on?
Yes.
And the
Okay.
partnership.
And the partnership. Yep, I don't have that in there. The generator from Celeste Havner. Maybe you can help us, Luke, since you're up next. Well, you're not up next, but do you know what she's talking about with the, do all the volunteer fire departments have a generator?
No, none of them do at this point.
Okay.
So I think it was well intended. This is my understanding. I haven't spoke with her personally. But looking at what our estimated costs for generator are, and that we had, we're looking to try to figure out how to put a generator in Centennial. I think that it was a good intent on her part, but again, I don't know.
That's fair enough. We can send a letter to both Rebecca and Celeste and say if we need some more information if you're serious about these requests.
Sure.
Thanks. Well, that's why you're here. You prioritized for us, and Eber, you were here for that, or were you? I can't remember. Were you here when Luke was?
I was.
Okay. So his green would be his 1, 2, and 3. Is everybody on board with that? Eber, you on board with that?
Yeah.
Okay. Okay. 4, 5, 6, 7, 8, and 10. 4 through 10 are in the yellow. Any of those interesting to you guys, or do you want to stick with the green and do that and then move later on? What's your pleasure?
Well, I'm thinking that the total available is 7.5 million, right?
Right.
So we have double that in to
Request.
consider. Yeah.
Well, I think sheriff's got a salary increase of a little over $4.25 in there, $250,000 of that, I'm guessing. Is that right? Does that all add up?
Not in the red.
Yeah. Oh, so it's not eligible. So you didn't count that. Okay. Yeah.
Yeah, so I guess I have a thought, and that is lots of these things that would go into the Centennial Fire Station. Let's see. Most of the volunteer fire stations are equipment storage only. There are a couple in the whole county that really kind of double as community centers. And Centennials is one of them. It's not the only place out there where people do, but it is one of them. And you guys have power there. The issue is what happens when the power goes out.
Yeah, definitely what happens when the
So
power.
this is like backup generators kind of thing.
Yeah, if you're speaking to the generators, number 7, yeah, generators, and really what it has to do with the main things that those generators help to provide is power to the SCBA compressors in the event of a structure fire. And then also the headset radios in terms of a base station at the station itself. Without backup power to those radio stations obviously are not in play if there's a wildland fire up above.
Yep.
So those are the big things for the generators. Of course, trucks can be plugged in. Heaters are what they are. But those are the two big things that generators provide is comms and then air.
So to me, but that one is for backup power and generators. Says fire district 1, but is there a specific place that you'd be using in Centennial?
Yep, the reason why it's broken down to 90,000 is based on the 5 primary stations at 15,000 apiece.
Gotcha.
So the primary stations being like Big Laramie, Albany County Central, Centennial Valley, Vidavoo. So
Vidavoo, and the 5th one's probably Waikolo.
I don't believe Waikolo is a 5th primary station. We've got Central North, South, Centennial, Big Laramie, and Vidavoo. We already talked about. So
yeah. When you said Central, I only counted that once.
Yeah.
So then I'm thinking about Celeste. I'm kind of going back there in my brain. She might be thinking about the one that's there by the
Buckeye
Ranch.
Buckeye or Albany. I'm not sure. Like I said, I'm not sure what she was requesting for.
We'll get more from her. Are these yellow, Luke, covered with those impact assistance funds that we requested?
Some of them are requested on both.
Okay.
I will note that with the approval of the ADA restrooms, a big part of that is providing water to those facilities. So by approving those, the laundry facilities number does go down. Because that way then would have water to that. And I can get you a more accurate number what that would be, but that's generally speaking a washer, dryer, a bunker washer, that type of thing. The big part we were looking for there was decontamination. So that number definitely does go down. I don't know how much it would go down.
Could you maybe give us also what you guys asked for in those impact assistance funds?
Yes.
That is covered in this group here.
Sure.
That would be super.
Sure. We can do that.
Awesome. So the green, is everybody on board with the green for Luke?
Yes, and I'm probably on board for a bunch of the yellow, but we're going to go back through.
You're right. We're going to go back. He's going to get us some idea about what was covered with the impact assistance funds with the rail tie wind hearing we had last week. Was it last week? 2 weeks ago? Seems like forever.
Yes, 22nd.
22nd, yeah, last week.
Whatever week that was.
Yeah. Okay. Awesome. So that brings us to Sheriff Applehands with the ACDC medical contract interview room. Interview room is green. ACDC medical contract may or may not be green, depending. Seemingly that at least part of it could be covered. What's your pleasure, commissioners, on both?
I'm fine with both. Yeah.
How about you two?
Yeah.
Okay.
However, the medical contract shakes out in terms of its allocation. I'm fine with it.
Okay. Elections, parking lot drainage with Jackie.
Yes.
Yes.
Have to.
Yeah. Okay. That takes us, Luke already did that. So how many count of courthouse water fountains, portable electric signs, water fountain update, AEDs for courthouse, how many county fairground improvements? Looks like courthouse water fountain update is the one that's green. I suspect we can get those AEDs on some other funding. Yeah,
I actually might be on to another funding source to get AEDs.
that's what I was thinking.
So that's kind of why I left the yellow.
Okay. Yeah.
There's money out there, so I just have to find the right one.
Yeah, we should have them in these buildings. And so whatever it takes, if it can go somewhere else, great. But if it has to come from here, I'm a big supporter. Okay. So for sure, right now we'll do the water fountain update. Sue, you all right with that?
Yep.
Heber, good with that?
Yep.
And we'll look for the AEDs. Portable electric signs, Rob Fisher. Any heartburn over that? I didn't see Rob on today.
Positively done. I can't believe we don't own it.
Yeah, I think.
To communicate to the masses.
Right.
You gotta have
Multiple use now.
And maybe the the detention center LARP generator, maybe somebody can help me out with that. Thank you, Sheriff Appleton, because Blake's no longer here with us.
So I actually didn't know that this one was on the list, and it was brought to my attention last week. So we started to do some research. We didn't actually look into any of the funding. If we could fund it, I started looking into the generator to see if it actually needs to be replaced. This one, we need a little bit more time on to take a look. As of right now, it doesn't look like it needs to be replaced. But we're still trying to figure out, it is one of our oldest generators.
Okay.
It has really low hours on it though.
Okay.
And so it still seems to kick on and work when needed, except for one time that it needed hose replaced, which was a $12 fix. So we need to definitely kind of take a look at that. I also don't know I don't know if that 150,000 is accurate or not either.
Okay.
If we do have to replace that generator, it's a huge generator, and we would have to relocate it and get a different generator to work on a different fuel source.
What's that thing run on?
Diesel.
It needs to run on natural gas.
Right. To do that, though, we would have to take it out of the first floor of the detention center and essentially move it outside of the detention center. The reason why I'm a little bit hesitant on that is because that's probably going to require us to dig new lines.
Right.
And your costs go up when you do that.
Yeah.
So this is one, I don't have a good answer for you. I don't know.
Okay, super. Adam, your next on it, do you have a little more knowledge, or was this just?
The only thing I was going to add to that is because this is one thing that Blake reached out ways back when we were actually transitioning the generators. He asked me which one the oldest one was. I said, Lark. I said, Adam, which one would you replace if you had to? I said, Lark. But primarily was to standardize the fuel source so that you didn't have to truck in diesel if there's a long outage. I think that generator will run that tank dry within, I think it's probably like a 16-hour runtime. Yeah. You do have to replace it pretty frequently. And I know Rob has been on the ticket to essentially haul up diesel. So that was, I think, the primary factor there. So again, I agree with Sheriff Appleton. It needs to be investigated more.
Okay, super.
So that thing's inside, it's in the Sally port?
No, so it's in a different area where our mechanical area is. It's got proper ventilation,
Right.
but that fuel line comes from outside in to run that
So
whole
you fuel
generator.
through the wall, it takes fresh air in through the wall, and
Mhm.
puts exhaust out through the wall.
Yep. Like I said, when I took a look at it last week, went through my maintenance staff and looked in there, it runs really well. Like when I met with EMA, they said there was one time that it didn't work. Lark had to relocate, which is a backup plan anyway, to relocate to Station 3. But if that generator isn't working, the comms aren't working on there as well. So it's really important. And so we investigated what broke down the last time, and it was literally a radiator hose, an 18-inch rubber hose that was quickly replaced, and then it worked. And so that's why I said it works. It does work, but replacing it is old. It is old fashioned. Was built in an infrastructure back in 1992, and we do things a little bit differently now in 2021. And so it's definitely something we really got to take a look at and see. So like I said, 150,000, maybe not. I don't know how much a generator that big costs and what the associated relocation construction costs would be.
Yeah. Adam, you have something on it?
Yeah, go for it.
A thought would be, if you're not going to replace the generator, possibly add the ability for an auxiliary hookup so that if there is a failure, you could get a portable set on site with already established auxiliary transfer areas. So we don't have to go through what we did at the courthouse here, where you can already, okay, here's my set. I throw in my long leads here, they plug in, and you're back within that time set instead of a large major outage if you want to weigh the other side. Just an idea, but again.
That's the best one.
That's an interesting idea.
United Rentals and your rental.
Well, you're limited on that side. I think I believe it's 150 kW. And I had to come out of Casper to get one with equal size, not the same size as what runs the courthouse.
Yeah.
So that seems 150 kilowatts.
Okay. And then the MOU with the city county, thanks for being willing to do that research. Seems to be maybe outside the scope a little bit. I don't know if somebody can do that research. I'm sure Bailey, the MOU planning and zoning, you did city planning with us. That didn't seem to fit within it. And I'm not sure, I don't disagree with you.
I think I need to look
Yep.
into your plan a little more. I need to look in. I just don't know.
You're right, exactly. That's fair.
I don't.
Yeah, that's
I
fair.
think, I mean, it might, but it might not.
Okay.
They seem very- They do, it's a lot of, I don't know. I mean, the water is a little, every time we get a hand off public health, the water's a little.
Okay,
But I can look. for it.
Thank you. Thank you. So that, and then we have broadband from the commissioners and solar and batteries from the commissioners. I will do the research on some of that solar and battery stuff. We might need a year's electric bills from each of the buildings. And then we might also need somebody to, maybe Roy, to give people access to the roof on both, all those buildings. And then we'll get an estimate pretty straightforwardly from using Google Earth and that kind of stuff. So, and David, we might think about you too, and maybe all the county buildings. I'm not sure why we wouldn't do something like that. So that's what I have. Does everybody have kind of what? And then Evelyn, your crew, trying to think, anybody have an idea on how to work with the nonprofits? Okay.
So we have kind of like that, like all of the data to make it community wide participation, all of the things like that, $1,000. And then like the impact to run that classes.
Okay. Fair enough. Sue or Heber, you have any thoughts on any of that? Just, should we? Yeah. Should we stand by for the dollar amount, but have Evelyn give us a little bit more from the nonprofit world? See if there's a.
Mr. Chairman, to figure a dollar amount, it would be fun to add this stuff up that we said, let's go with, and then.
Well, Bailey's done most of that, so it's $4,659,000 for all the green. And it looks like we didn't turn our nose up on anything but the internet expansion at the library at this point. Yeah.
Chairman, sorry, I was just gonna point out that in the green on the aerial imagery for
Right.
Chelsea, that is only 1 year.
Okay.
So if you wanted to do additional, that would allocate additional money in there as well.
Okay, thank you for that. So you would add another 874,000 to that number in the green, which gives you about $5.5 million.
So I guess at this point, everybody,
I apologize. Does that include the ACDC medical contract? Because that was the one in yellow.
That does not, so that would be $8 million with the ACDC at the total of the ACDC. If there was less than the total, then you'd be looking at about 60% of that, so about $3.3 million.
so at this point, everybody kind of knows which direction we're thinking.
Yep.
And everybody can turn all their items into me. And then you guys want to try to plan on doing another work session in like a month or so, or what's your plan? So we kind of have a deadline to work off of.
Well, a month works for me, but I don't know if it works for like Evelyn. That's, is that going to be a pretty difficult time?
I will make it work.
We can do longer too. I'm just throwing it out there.
Yeah, Chelsea, please.
For the aerial imagery. Price.
Yeah, so maybe the 15th of November, that gives us about 6 weeks to work this. So would that be something that's a timeline and then that would give us another 6 weeks to figure out the funding? Does that sound like a reasonable approach to this? So a work session in 6 weeks with all the particulars and then decisions by the end of December for at least the first round of stuff.
Yeah,
That's reasonable?
I think that sounds great. Anybody else?
Okay,
Comments?
okay. We'll figure that out.
Okay.
Where the November 15th one would be, that week of November 15th, which. The week starts November 15th, 16th, 17th, 18th, and 19th. And I don't know that I have any. We have a meeting, the second meeting of the month is on the 16th for the commissioners. And then, yeah, that's what I have so far on our county schedule in my phone. So that doesn't mean that's the full county schedule. That's just the one I put in my phone. Jim, will that give you enough time? I know that's pretty quick on 6 weeks. Okay. Well, can we put that on the second agenda for November 2nd agenda for the county commission meeting to sort out that work session date for the week of the 15th? And then we'll have a date for everybody after that commission meeting. Does that work? Anything else?
Just when it comes to broadband, I know that ARPA funds can be used for that, but there are also other funds and maybe some, in other words, they wouldn't have to be drawn exclusively from this. It would be a good challenge in a couple of months to figure out what's where and how to attack and price out the remedies, you know what I mean? That might be a bigger project than.
Yeah, I told everybody I would send a letter to Jeremiah at WCCA about all the different broadbanding sources of funding. And if the state had ARPA funding, it was going to be towards that. And then maybe we'll have an idea about infrastructure being passed at the federal government level by end of this week, maybe. Who knows?
That could totally change it.
Yeah, that could change some things. But yeah, I think this is a great start. I don't know. I'm really grateful for you guys being willing to do this work when doing your rest of your work. And then this gets us a real nice start and a place to begin. Thank you. That's all I have, unless,
Did most of you feel like your priorities were met?
Yay. Yay, awesome. Yeah. And did we get mail delivery here today?
Yes, I got that.
Yes. Yes.
God.
Fantastic. All right.